All right, letting people come in here. It's 6:30 on the dot for another webinar Wednesday, I guess we got here. You should be seeing the screen showing the 30 minutes on Medicare basics. We do try to stay high level with this. I promise it will seem like we're not really focused just on the basics. We do get into some details here. But it is a complex it is a complex changeover that happens at this transitional point. So the purpose of today, again, is some good high-level information about Medicare and this transition to healthcare and retirement, giving you some good information for the starting point. And what we do typically before we ever get started is just, again, a little echo about who we are in our team here and the team of us that's working for you and who we are. And we have a full team working together to support. And what we do is really helping to confidently guide our clients to and through retirement. That, and again, we ask always that you share this information with others. Don't keep it a secret, but confidently guiding you to and through retirement. We look at it as the four key elements of retirement planning. You can see Medicare is one of the featured subjects on here. Those of you that have attended other events that we've hosted as well. Social Security, tax planning, long-term care. I mean, these are areas that affect most all retirees, and an area that we believe that you have to be an expert in if you're going to be working as a retirement income specialist or working with retirees like yourselves. That's why we put a lot of time and energy into educating ourselves on these topics and areas and run the events that we do. So again, we do run regular events and webinars and believe strongly in education, helping you make informed decisions, right? At the end of the day, we want to make sure we align your actions with your intentions. So into the topic at hand for the evening, savvy Medicare planning. So first, just opening it up with what is Medicare? So Medicare, national health insurance program for people age 65. So what that is, it's our national healthcare program. It's our retiree healthcare plan, who it's administered by, Medicare and Medicaid services. The enrollment's pretty much done through Social Security, which is something that sometimes gets a little confusing because Medicare and Social Security, while they are not exactly intertwined, they do have some overlap that we'll be touching upon today as well. But essentially, it's our national health insurance program that's available for people age 65 and older who qualify. So who is Medicare actually for? Everyone over age 65. It's a U.S. citizen or legal residents that have lived in the U.S. continuously for at least the last 5 years, and some people under 65. Those typically are for people who are, on disability type of benefits. So we're going to be speaking primarily about the traditional Medicare available for those over age 65. So as we talk about what Medicare actually is, where it starts to already get a little more complicated is that it's not just one standalone thing. There is different parts to Medicare, as you can see here on the screen. So those different parts, Part A, Part B, Part C, Part D. To break those in, if you look at the bottom of the screen, it shows Part A and B. Those are both provided by Medicare. C and D, you see those are provided by private insurers that contract with Medicare. So they work with Medicare. So the primary pieces, the first two parts, Part A and Part B, are the ones that most people are as the most familiar with and that mostly affect all of us, but we're going to touch upon all parts. So Part A, hospital insurance. That's really, again, if you're admitted to a hospital, more that emergency type of care. Part B, medical insurance, more what most of us are accustomed to in preventative care, regular physicals and appointments and things like that you have. We'll talk more about C later, this Medicare Advantage. But the other part, D is pretty simple because it stands for prescription drug coverage. So making sure your prescriptions and things like that are covered as well. And we'll come back to, again, see a little bit later what these Medicare Advantages are. So as we look at this, and there's those four different parts, not everyone gets involved with all four parts, or no one really has all four parts in play. There are four parts, but what we look at here is there's two different options on the screen. So there's the original Medicare, and then there's Medicare Advantage. Option 1 and option 2. So these are not intertwined together. It's one or the other. So what happens is, as you can see on the screen, both have Part A and Part B. If you're looking at each one, option one and option two, they both have that Part A and Part B that's provided through Medicare directly, and that hospital insurance, that medical insurance. And then where they change is this Part D coverage and the on the and on the left you can see the Medigap type of coverage. So we're going to talk more about the pros and cons of each of these different paths forward, but typically both you're going to want to have a Medicare Advantage plan, or a Medicare drug plan, prescription coverage. On the option two Medicare Advantage side, it's the C you can think of more comprehensive. You get maybe it's a drug plan that also has the supplement or Medigap coverage kind of built into it already. So think of C as comprehensive coverage packed into one. Original Medicare having more of those three separate primary pieces, A, B, and D, and then adding in this supplemental or Medigap insurance. So we talked about the parts a little bit, and we're going to come more to that. But talking about something important is the Medicare enrollment and Medicare enrollment period. So the basic principle of enrollment is unless you're covered by an employer plan that's a qualified employer plan, which typically is one that covers 20 or more employees, but you always want to make sure that your plan qualifies, you have to enroll in Medicare when you turn 65. If you do have a plan that's qualified, you're still working over age 65, you don't have to turn on 65. There's many cases where you still might want to elect to. But again, if you are not covered, you have to start coverage at age 65. So I say you have to. Now, what if you don't? What if you don't enroll in Medicare on time? Well, that's when there can be late penalties, where you now are forced to actually pay a fee or a cost for not enrolling on time. The other part of it is, well, your healthcare expenses might not be covered by insurance. You might have a gap in coverage at this period. You might not actually be insured. So God forbid something happened at that point in time, you might not have medical coverage to pay for those services. Private insurance options also can be limited. Just like an enrollment period in a job, you have the period of time where you're able to elect and get into things. If you miss that window, sometimes there's extra hoops to jump through or certain plans or options that might not be available for you anymore. So again, enrolling on time is crucial. So what is that if you are receiving medical, or how do you enroll in Medicare? How do you enroll on time? Well, if you're receiving Social Security when you turn 65, which for everyone on this today would be taking Social Security early. Most on this call, your Social Security claiming age is most likely 67, or maybe some between 66 and 67, that age when you're, say, on target, that full retirement age for Social Security that they show in your statement. If you are receiving those benefits, it's automatic. Parts A and B will automatically turn on, but you can decline Part B if you need to or choose to. You don't need it at that point in time. Maybe you have the other employer coverage, but if you don't decline it, it will automatically start. And a coverage starts that first month that you turn 65. Now, Part C and D, depending which path you go here, those are not automatic, right? Those are things you have to elect. You have to choose. You have to actually kind of like shop and do some homework and research into what type of plan is the best for you. There are healthcare brokers out there that work specifically in this space that you can work with. We work with some that we network or refer out on a regular basis. Also, you might have a private insurer you're already working with. Maybe you have Tufts or Blue Cross Blue Shield. They have packages probably soliciting you and mailing things out to you as well about their Medicare plans, their supplemental plans, their Advantage plans. A lot of times that's where we recommend people start, as well as checking with maybe their current providers and seeing what they have to offer. And another big piece of that too is making sure that your actual healthcare providers, doctors, that they accept the Medicare coverages, or if you need to make any changes. So now, what if you're not on Social Security? What if you haven't claimed yet? What if you're still holding off and waiting and haven't claimed earlier? Well, now it's an act that you have to take. You have to actually go out there and elect to turn on Medicare or to enroll in Medicare. And that initial enrollment period, if you're not covered by a group plan, is at age 65. The special enrollment period, if you're covered by a group plan, That's also, again, comes available at 65, or if you were to leave that job, have it change where you no longer have that qualified coverage anymore. You didn't start right at 65, you had that job that you didn't need to. But when you leave your job, it's a special enrollment period. Just like in those working years where if you left a job, start a new job intra year, you can hop into their healthcare plan. You don't have to wait to that normal or general enrollment period. But if you miss the initial, you miss the special, well, then you have to wait for the general enrollment period, which that could leave you susceptible to a gap of coverage or risk there. Not to mention those penalties that we brought up earlier. So you want to make sure your coverage is going to start on time and for when you need it. So if you apply for your coverage before the month you turn 65, the coverage starts when you turn 65. If you start or apply not until the month you actually turn 65, it's going to be the next month, right? There's the administrative time of getting these things activated. So you want to be ahead. And then again, you can see the 1 month or 2 or 3 months afterwards, but really we should be trying to get to it before age 65. They allow you to go up to 3 months before. We'll come back to that also, but you can enroll in that initial enrollment period after 3 months prior to your age 65. So who signs up for Part A during that initial enrollment period? Almost everyone who turns 65 signs up because it is hospital insurance. The thing with Part A is you do not pay for Part A. There is no premium for Part A. You qualify for it or you don't qualify for it. If you qualify for a Social Security check, you qualify for Part A Medicare coverage. So it's one of those things that for most people, it's why would you not have that additional coverage in play, even if you have an employer plan? Well, there might be some extra coverages or benefits by having the two working for you in a hospitalization situation. But again, if you're covered by a large group plan, you might have the ability not to turn on A. For a lot of people, the main reason why they wouldn't start Part A if they were covered by a group plan is if they're participating in a health savings account, that HSA plan. Because that's one of the rules is that you can't be contributing or have a health savings account. You can have an account, but you can't be actively contributing and making contributions to it once you enroll in Medicare. There's that period of time that you cannot do so. So for many, if they're still working, they have a group plan, they want to keep putting money into these HSA accounts, well, then that would be a reason why we don't want to actually elect Medicare Part A. We keep that packed in. But if you weren't, you're on a typical HMO, PPO plan, not a high deductible HSA type of plan. I know I'm rattling off some different letters here. That would be a time when, hey, why would you not turn on that extra free coverage in case, again, that and your employer plan might work well together and fill in potential gaps in coverage if there was a need. So who signs up for Part B, though, during that initial enrollment period? So Part B does have a premium. Part B, you do pay a cost for. Well, that typically, if you're covered by an employer plan already, you're paying into that health insurance, then yeah, why would you turn on this additional coverage at that point and start paying an additional premium for your Part B insurance? So those people will typically not start it. The ones that would, if you're not working, or maybe your healthcare plan just isn't that great. Maybe you're self-employed, you're paying into your own healthcare plan, it's expensive, and now, hey, Medicare became available. It's something that you might be able to find a quality plan for yourself that might be less expensive. You're at a company where their plan doesn't qualify. You have to enroll, right? If they have less than the 20 employees, it's not a qualified plan. Okay, well, now we're in that list of, well, we have to. That's who's going to sign up. You have to. Cobra, which is one of the things where if you left your job, you could keep their coverage for a period of time, typically 13 months after leaving the job. Cobra plans are typically expensive. You're paying the full healthcare premium and then typically a 10% premium above that to keep that coverage. So transitioning to Medicare might be a cost savings there. Receiving retiree health benefits. Maybe there's other benefits that you are actually receiving at that point in time. But you want to just see if it's something that's going to help you and fit in for you, or if you're already covered at that point, if you would or would not sign up for Medicare Part B. But the big part is, do you have coverage or do you not have coverage at that point? Now that Part D, the prescription coverage, if you signed up for A and B and you want prescription coverage now or in the future, you're going to need to enroll in a drug plan. So those plans If you do not enroll at that initial period of time, they also have late enrollment penalties. So unless you're covered by a plan, like we were talking about before, and not electing to start A and B at this age 65, you also want to get a drug plan. Because if you wait and add it later, which you could do, there's an extra premium, an extra late enrollment penalty on it. Below that, you see that there's two options for Part D. And that's just saying back to that first screen that we had up there, not first, but the first one where we started to get a little more confusing is option one, option two. There's a standalone prescription drug plan. So if you did that, it was on the screen, option one, where you get the A, the B, I get my drug plan, my D, and then maybe I add some supplemental coverage. Or sometimes these Part Ds are actually packaged into the comprehensive plan, into that Part C, these Medicare Advantage or comprehensive plans. Most of them come with a Part D or RX is how they'll label them, an RX plan built into it. So again, you're going to want to get this coverage out the gate during that initial enrollment period. There's two options depending on which way we go with that option one or option two. Now, the special enrollment period, again, is if you were covered by an employer plan and then you left that work. You leave that plan or you lose that plan. Well, now you are subject to that special enrollment period. So anytime before the coverage ends, before you left that job, and you also have 8-month period of time starting after the group coverage ends. So that's the special enrollment period from the end of the job for 8 months for Part B. Now, Part D, 63 days after the coverage ends. Now, that's to avoid, penalties and things like that for late enrollment and to be able to enroll during this special enrollment period. Also, though, for no gaps or lapse of coverage, you're going to want to enroll or have it set up before your coverage ends, which it's set to then start once your other plan is, terminated and no longer there for you. So the best time to enroll in Medicare to avoid those late enrollment penalties is during the initial or special enrollment period. There will be other options down the road if somehow we miss those, but that's your intention. That's what you need to be aware of and what you need to act to get in is during that initial or special enrollment period. It's just how you make sure there's no gaps or lapse in your coverage. The general enrollment period, if you miss those, and also if you're currently enrolled in Medicare, the general enrollment period is from January 1st to March 31st of each year. And then the coverage starts the month after you enroll. So this is a good point in time to also bring up that there is an enrollment period with Medicare every year. So typically for most of us while working too, you can change your healthcare plan each year too. There's an enrollment period. Hey, here's a time. Let's reassess. Let's look at things. Do I have any changes that I should be changing my healthcare plan at this point or not? So just know that there is this enrollment period each year for Medicare. So if the coverage you started with when you first started in those initial periods needs to change or evolve, you can change and evolve the coverage. So you don't have to pick the healthcare plan that you're going to want 10, 15, or 20 years from now in the beginning. You'll have the option to make changes later. You're really just on the hook for that 1 year for anything that falls outside of your plan. You'd be on the hook for any of those type of costs that weren't covered during that year. And then the next year you could review and look at, okay, I got to change my plan coverage to get something that's going to be better suited to me now. So I think, again, just making sure you're aware, we pick the plan that's best for you, now and right in the short term, and then it evolves over time. But that's during that general enrollment period ongoingly. First, make sure you get in during the initial or the special enrollment period. So review those enrollment periods. The initial one, right? Everyone age 65 who's not covered by an employer plan. But like I mentioned, you have the ability, you can sign up earlier than 65. Up to 3 months prior to that 65th birthday, you could go in, enroll, and coverage starts that first month of 65. It's ready to go. Love checking that box and just being done and putting it in the rear view. The special enrollment period, though, if you're over 65, you were covered by a plan, you didn't need to sign up. Well, now it's before that coverage ends is the best time to sign up for the plan. So when you know that coverage is going away, there's a planned end date, that's the time to sign up, but you have that time that fell afterwards, right? But remember, that was for Part B, there was 8 months, only 63 days for Part D. So like most things, we like to do our homework. And for again, you are by being on this call, doing your homework, getting informed, starting to be aware of decisions that are going to come in the future. So you're prepared to make those decisions at that time versus scrambling and trying to figure it out then. The general enrollment period, if you miss those two first ones, it's available. And again, it's also an enrollment period that comes every single year where you either keep your plans or you have a chance to make changes, which could be drastic changes or just little tweaks. So how do you go ahead and sign up for it? I mean, you'll most likely be solicited with it, but SSA.gov, the Social Security website, there is a button on that page that has you apply for Medicare benefits. You can call Social Security as well. That's where I said these kind of lines blur together a bit. Is that it seems like you're on the Social Security website, but there's actions that you can take for Medicare there as well. And there's also when we were talking earlier, the if you're on Social Security, the kind of automation of Medicare enrollment, and that it's more that you have to make sure you opt out of things if you don't need or want them at that time versus opt into them. So it does impact things. So they're intertwined. So Medicare Part D, though, remember that one, private insurance. It's always elected. It's nothing that you're ever going to be automatically enrolled in. So the thing we got to decide first is that back to that option one and option two of do we do original Medicare as they refer to it as A plus B, which everyone always gets A and B, and then we add a drug plan, and then maybe we shop for some extra, um, you know, standalone supplemental plans, maybe that you fill some gaps with. And when I say gaps, it's more enhancing your coverage, making sure maybe you don't want to have any co-pays, or you really want to make sure I don't have any out-of-pocket costs. I'd rather pay a fixed monthly expense, and if I have the doctors or I have something that pops up, I don't want to have to pay anything out of pocket. I don't want any surprises or extra money. I'll pay a premium, to fill some of those gaps and things. The other option on the right, the Medicare Advantage plan, which has a built-in Part D or RX plan with it. And those Advantage plans are also a supplemental plan. They typically have those extra benefits, lower copay, extra coverages, and there's a wide array of those Advantage plans as well. They've become more and more popular as the insurance companies are offering and marketing them more, and there's a wide array of cost to them. Some that will even come with a zero premium. They're billed based on, states and zip codes, even into counties. And typically, most things are what you pay is kind of what you get. So if you have higher needs, you might want to pay some premiums to lower the out-of-pocket cost that you would be paying throughout the year. Out-of-pocket cost meaning if you're getting regular treatments, maybe it's expensive prescription coverages. So you do have to shop and try to get a plan that's aligned with your personal needs. Know that you have the ability, though, to update and reshop each year during that general enrollment period. One other thing I'll bring up right now that one of our healthcare specialists did bring up to me is with Medicare Advantage plans and some of these private insurers, you do have to watch that they sometimes will have to make you like stay in a network. To get the services that you need, you might have to be in network. Go to this specialist or this doctor or someone, connected to their Advantage plan. Which, if you're someone that lives in a certain area, resides in a certain area, spends most of your time there, maybe that's a good fit for you. But for others, if you're someone, I don't know, you get in the RV, you're traveling the country, you plan to roam all over, that's sometimes an instance where the original Medicare can be things that have more flexibility and options to those providers out there. Again, there's information out there, solicitation. I do find that sometimes starting with your current providers is a good place to start and get education and ask some good questions about what their coverage is like, the pros and cons of their coverage. And you can, again, start to kind of shop for yourself based on what your healthcare needs are. The Medicare and private insurance, the out-of-pocket costs paid by Medicare, Part B premiums are paid to Medicare. The private insurance premiums for Part D plans, drug plans, or Advantage plans, those are premiums you pay. So you're paying for those base amounts of coverage. But then, like most of us have with our healthcare coverage or our working years, there might be certain deductibles. Depending on the plan, you might have large deductibles, low deductibles. There might be like co-insurance amounts, certain amounts that you pay and the plan pays so much, whatever that co-insurance amount is kind of like you're co-owning that bill. There's so much the insurance company pays and there's so much you have to pay out of pocket. Some of those more costly premium plans, they might have lower co-pays, lower deductibles, but you're paying a higher regular premium for those benefits. And then there might be certain services that are just not covered, by Medicare, like elected type of procedures. So breaking down the monthly penalties, or excuse me, monthly premiums, not penalties at this point. Um, Part A, again, you do not pay a premium if you have your 40 quarters or 10 years in Social Security. So if you qualify for a Social Security check, you get Medicare Part A. It's built in at no cost. They have the option that you can actually buy into Medicare Part A if you are below those 40 quarters. And you can see there's a range there from the 30 to 39 quarters, or less than 30. But again, if you have 10 years or more with Social Security, or 40 quarters, if they break it down into 4 quarters of 10 years for 40, then it's zero premium. Medicare premiums in 2024 were 174.70. I think we're up to about I think it's 184 right now, right around that for 2025. And then that's again the base premium amount. And Part D's vary widely, right? Depending on where you live and the type of coverages and things like that that you get. So the premiums can change. And these right now, what you're seeing, like the Part B, those are the base cost. They can be higher. And that's what we're looking at right now, is these monthly premiums for Part B and D, including income related adjustment amounts, because nothing's ever too straightforward or too simple. And what this is, an industry jargon or term, what we call it is IRMA, income related monthly adjustments. So this is where all of a sudden, if a certain amount of income is coming in, and we're talking things that hit your tax return. That's how they track this, right? Is things that hit your tax return. So there's a lot of numbers on the screen. What these MAGIs, modified adjusted gross income. But essentially, are you single filing? Are you joint filing? Are you married filing separately? Those are what those first three columns are on the left. And on the right, we're talking about, okay, what are those premiums, right? So the first level, if you're under those first numbers, married filing jointly, modified adjusted gross income of less than 206. And what modified adjusted gross income is, essentially your kind of your gross income. But we and planners like us do work with some tools and software to do tax analysis for you and look at what your MAGI, modified adjusted gross income, is, if you're projected to go above certain limits, or how we can watch them. Because you can see, if you go down to row 2, if you cross that $206,000 mark, just staying on the joint income for now, all of a sudden, you go over to the right, there's a $174 base Part B premium for this year. And then at the same time, then there's an additional adjustment, an extra almost $70 that was added on top. Plus, Part D gets an adjustment. So your premiums all of a sudden just went up, right? And there's all these different tiers where each one is if you crossed it by $1. Those rows keep going down. So you went to the next one. And again, the premiums go up even higher and even higher and even higher until finally they cap out when you're over $750,000. So this is when a true cohesive retirement income strategy and plan like what we work with comes into play, because this is based on things hitting your tax returns. Doesn't necessarily mean that you're not living on that amount of money. It's just, where did you get it from? Are you drawing from a bank account? If you draw from an IRA, right, it counts as taxable income. You draw or sell a stock at an appreciated gain, it's taxable income. You draw from a Roth IRA, oh, it's tax free. It doesn't actually count towards that MAGI. So these are things we look out for and see, how can we stay under these certain thresholds to try to keep as much money in your pockets as we can. So again, there are deductibles. Part A, per spell of illness, 1632. Part B, $240, waive for some preventative cares and things. Part D, 545. These are base ones. So if you have a comprehensive plan, a supplement plan, that can pay some of these costs for you as well. But just know that there are deductibles. There's out-of-pocket costs that we have to expect to continue to pay for healthcare services in retirement for most people, as well as the co-insurance that you have to pay. So depending on the situation, what you have to pay for hospital stays and what they cover. And you can see here in the hospital stays, the coverage of the first 60 days might be covered fully. But after from 61 to 90, okay, well, now there's a co-insurance amount. There's an amount that you pay out of pocket as well. From 91 to 150, 816. Or if you were transferred and living in a skilled nursing facility, spending some time in a rehab or anything like that temporarily, there's coverage for 21 to 100 days of 204. You can see there's nothing that goes beyond these times, and that's because Medicare does not pay for long-term care insurance. It does not. Hospitalization, skilled nursing care temporarily, yes, but not for long-term insurance. Part B, typically 20% for Medicare approved rates for assigned claims. Unassigned 20% plus any other approved rate. Again, it just can vary based on those other supplementals or advantage plans that you have that might fill in some of these gaps. That's why sometimes they're referred to as these Medi-gap policies, is they fill in these cracks in those other areas where you might have premiums that you'd be paying out of pocket. So you got to understand the drug plans and just know that you do need to have them. But drug plans vary widely, and the drug plan that's right for you might not be right for someone else. So you got to look at your own situation. It's important that you find a plan that covers the drugs that you take, right? That's what you want to shop for and what you want to look for. And you're able to do some of the kind of the math of it being worth paying the premium for the drug plan if it's going to cover the cost of the drugs and the services that you need. So again, what Medicare actually covers, hospital, 100% of the first 60 days. So that's under that Part A, which everyone has. But just understanding the whole gambit, what it covers. Hospital stay, first 160 days, yep, 100% is covered. Then we went through that previous slide. There's some co-insurance, some costs. Still coverage, but some cost. Medical services, typical outpatient services, again, regular doctor visits, routine things, 80% of the Medicare approved amount. Most of those are covered. And some preventative services like flu shots and recommended screenings and things like that. So those are typically covered by Medicare. But what it does not cover, as I already mentioned, long-term care delivered outside the US, dental, vision, hearing aids, cosmetic or elective things, acupuncture, and alternative cares. Amounts over those Medicare amounts are those amounts that are, deductibles or co-insurance. These are things that sometimes those Medigap and those Advantage plans might cover. A lot of times the Advantage plans even have dental or vision or hearing. They might have other ancillary kind of benefits packed into this comprehensive coverage. So that's why you want to think of your full care package. There are individual dental and vision plans. So there's all different ways you can build it a la carte, or you can go into some of the comprehensive options that are available out there. Now, what the private insurance may cover is, well, things that maybe Part A and these things don't cover, right? So hospital costs after those 60 days, some of those co-insurance amounts, some of those prescription drugs or deductibles, like I've been saying. So the private insurance can fill in those gaps, those laps in coverage that you might have with just traditional Medicare coverage. Again, Medigap. That's why they're referred to that way, Medigap or supplement. Advantage plans have them typically built into it as well. Those enhances to coverages. They're sold by the private insurances. They're not something you do directly through Medicare or ever going to be automatically enrolled in. There's something you have to seek out. And again, there's a lot of solicitation that will go on out there with mailings and things and notices. I personally find that sometimes, again, the best place might be to start with a current provider if you're happy with them. If you're not happy with them, then it's a perfect time to be looking elsewhere and make a change to a recommendation maybe someone else has, which always a fan of getting a recommendation from someone else who has experience with something. But that's to the company, and then you need to find the coverage that's right for you, right? Because it's a personal choice, personal decision. Now, there is some standardization to these Medigap policies. So they're offered by private insurers. They do contract through Medicare. So they're forced to have certain standards to their plans, which is great. So they have to have certain kind of rules around them. But you have to know that these Medigap plans, you don't combine Medigap and Medicare Advantage. They're one or the other, option one or option two, like we went to at the beginning. You pay premiums for them, and the cost can vary widely by the plan, the company, the location, wherever you are. So you want to shop them around or find someone to help you shop around for them. And again, just start by doing your own homework. And like anything else out there, go out there and ask someone who works in that space specifically of what they can do. We can cover some good high level information, but like I said, then typically we point you to direct providers or something like a healthcare broker who specifically works with these type of plans. So healthcare options approved by Medicare, Medicare Part C. These Advantage plans, they're run by private companies as well. You pay, Medicare pays for the member's care. You have to use usually in-network doctors, like I was saying earlier. So that's can be a con for some if you don't want to be kind of stuck into a network. You want to have more autonomy and choice over things. That is one of the major reasons that some people will go option one or two, back to that original silo of the Advantage Comprehensive to the a la carte. The plans typically have prescription drug coverage. Most all do, but RX is typically the little symbol at the end of it that you'll see there. And they often have extra benefits like vision or dental. Some of them even have like living benefits now that they'll package in there as little bells and whistles, like gym benefits and things like that they might add. So there is a lot kind of in that you can unpack and see what the best one is for you. You got to shop, right? There's some standardization, but they do vary drastically still. So you got to look at what works for you, the coverage needs you have, who are your providers, who you get your healthcare services from, what do they accept? So that could be something as part of your homework to start bringing that up and having conversations with them about what happens when I transition to Medicare. What type of coverages do you work with? Do you accept? Do you recommend? Because they have a lot of experience working with people as well of things that are covered or not covered. So again, just kind of source a lot of this information you're able to bring in to help you make your best informed decision, which is our whole goal in providing this information and getting ahead of it for you is that we can help you make that best informed decision. But the drug plans, same thing. They vary considerably, as you'd want them to, because some people might not have any needs for these drug plans or very minimal basic needs, and others might have more substantial needs. So it's nice to have the choice and varying cost to make sure you get into things that cover what it is that you need. And remember, again, you do have these enrollment periods and general periods each year that you can make changes. The one thing you do not change is that do you go option one or option two? Once you pick that road, you're pretty much on that road. So again, that's what they're talking about here. Medicare plans, just they vary considerably, including the Advantage and the private ones. So a final word on healthcare cost and retirement. It's a cost. It's a cost that we have to account for in our planning. It's something that we have to know there will be costs. They could change and evolve over time. Plan for the best, protect for the worst. So we have to make sure that we're aware that the budget could change. Premiums could go up. Out-of-pocket cost could go up. A change in your health status might require more expensive prescriptions. You might need additional services that you didn't need before. So there might be things that just weren't covered that now you need or want that you might have to pay for. So we have to make sure that healthcare is factored into a retirement income plan. So when you prepare for this, I mean, the studies and things done out there all the time. Fidelity has done this as a source, and they're saying that for couples living, the cost in retirement could be almost $315,000. Sounds like a big number, but when you break it down and think, okay, if we're living 30 plus years in retirement and you break that down for two individuals per year, it's like, yeah, it can end up being a pretty big number spread out over those many years that's factored into the budget. So we just have to make sure again it's part of the plan. Long-term care. Remember, just long-term care is not covered. It's not covered by the private insurer, Medicare, Medigap, Advantage plans. None of those cover this. Skilled nursing care after 100 days is not covered. Help with activities of daily living, no coverage at all. Long-term care is its own separate thing that you have to plan and navigate. Can you afford to self-insure? Meaning, can you afford to pay for care out of pocket if you need extra help and assistance? And these activities of daily living are sometimes what they refer to them as ADLs, and things that if you have insurance, which you can buy long-term care insurance, and there's things out there today that have gained popularity like hybrid long-term care insurances that are both life insurance and care. So well, if I need care, I can access it for that. If I don't end up needing care, I pass away without it. Well, there's a death benefit that goes to my family. You essentially know that you didn't pay to something that you're never going to get or your loved ones aren't going to get any value out of. But it's its own separate challenge that we have to navigate and plan for, which is why we also run a whole separate webinar and topic on preparing for long-term care. And we work extensively with those plans, products that support the plan, self-funding, helping you derive what's your strategy if this situation arises. Because when we think of a plan, we're always trying to think of, okay, what could cause this to go wrong? What would cause us to wake up at a point in the future and have a risk of having our plan not work? And sometimes long-term care is one of those risks that's out there on the table. Now, long-term care, depending on what the services are, can be very expensive, but it can vary widely too. Some people just need a little help. Couple days a week, having someone come in doing some extra things around the house that you might be able to pay for. There could be, outpatient places where you go and you stay somewhere for like adult daycare type of things where you go somewhere for the day. Or there's actual facility living, which those can vary widely as well from the level of care and also the type of place you have. Are you in a private room? Do you have a semi-private room with a roommate? Is it full nursing type of care that we need or cognitive care? Or is it just, again, we're residing somewhere for a little bit of assistance, but we're mostly independent while there? You can see the cost here can vary drastically, but these are per day cost. So when you start adding those things up, I mean, they can be substantial, up to tens of thousands of dollars a year for some of the higher cost, care. So you got to prepare for long-term care as well. Part of it, I mean, many of us have experience with caring for a loved one. There's a lot of that live in what they call the sandwich generation now, where they've been taking care of elder parents, also then helping trying to get their kids out and on track. And you've had that kind of the burden of caring. You're gonna do what you got to do or what you can do to try to help and support, but it's not that it wouldn't have been great if there was funds or monies or things there to get some help, to get some freedom. And sometimes those are even just ability to have a couple days off or not be the primary caregiver. You're still there to assist, but sometimes, again, you just don't want to be the primary, the only caregiver. It can wane on relationships. It just avoids you having to spend down other assets, right? Is if you're able to have some protection or things labeled specifically towards long-term care. So it's just something where you got to have a plan for it. So 3 reminders, going back and reflecting upon what we've talked about so far this evening. Enroll in Medicare on time. You need to enroll on time. There's the initial enrollment period, the special enrollment period, age 65 initial for most everyone, unless you're covered by a big group employer plan and still working. And like we said, you're still probably going to enroll in Part A unless you have an HSA. If you're in a high deductible HSA plan, that is the biggest case where people do not elect to start Part A at 65. Because again, Part A is the one that is no premiums. So if you do not have the HSA issue, why would you not have that extra coverage come into play? So we got to make sure though that we are enrolling in Medicare on time, up to 3 months before that 65th birthday that you can do it. And then again, prior to even leaving that job that you could do it as well. Reminder 2, shop carefully on the private insurance. Okay, you got to look at it for you, do your homework ahead of time. Those options of the path that you go to, there's a lot of resources out there. I find talking to people that's their specialty, that's their niche, and trying to ask them what's the pros and cons of this. Again, whether it's a Tufts or Blue Cross Blue Shield, that you go to them directly at what their plans are. And no, of course, obviously they sell their plans. So let's be aware of the information you're getting and make sure there's not any biases to it. But they should be able to at least be a Q&A factor of, let me understand what I'm covered for and what I'm not covered for. Okay, and then if you want to talk to a broker as well, someone that works both on the Medicare Advantage and the supplemental and Medigap and get true kind of guidance, well, you can go that route as well. And again, we have someone that we can always recommend in those areas too. But I like just starting usually with those providers that you currently have if they already work with your caregivers. And then 3, prepare for higher healthcare costs in retirement. Higher cost in general is something we prepare for in retirement. We like to tell our clients what we got to make sure we can do is make sure you retire with a good, steady income stream that you can depend on, that we have the ability to give you a raise in the future if and when you need it, because costs don't stay stagnant. And also, we like to make sure we have a emergency type of fund. If there's a lump sum need or emergency or something pops up, do we have that liquidity and access? And those are what we want to make sure: dependable income, ability to get a raise in the future, and then also that liquidity type of fund. Can we get our hands on some money if we need it for something? So For this evening, that's the topic. Medicare, thanks for joining us. Please, again, don't keep this a secret. These have now been recorded and are able to be shared. There'll be an email and a link sent out following that these are set up on our website. You are welcome again to share and pass this information along, and hope you enjoyed the content this evening and hope you have a great night. Thank you very much. Take care.